Welcome one and all to the Health Coalition Aotearoa Hooked What We Know About Vaping Among Youth in Aotearoa. My name is Claire Amos and I have the absolute privilege of being the tumuaki at Okahukura Matua. So I am the principal at Albany Senior High School and I have the absolute pleasure of being your facilitator here this afternoon. In terms of why I got involved in this webinar, this is a topic close to my heart as a school leader, working particularly in the secondary space, but I know it is an issue increasingly for our colleagues in the primary space as well. Unfortunately, I have got to see firsthand this impact this is having on our young people. I have often reflected on the fact that just a few years ago, smoking actually wasn't an issue for us as school leaders. It was very, very few and far between that we had young people that were still addicted to cigarettes. It was a really rare occurrence. And so it was absolutely gutting to see the absolute proliferation and the addiction to vaping that is now prevalent among our young people. And the thing that really concerns me as a school leader is the addiction that is happening to nicotine and the reliance on these as a mechanism for dealing with stress and anxiety. And whilst all of us try and maintain a vape-free and smoke-free campus. Of course we do. We're more than aware that it is something that students are trying to engage in throughout the day and are actually struggling to manage themselves. So I am really happy to be here facilitating this webinar this afternoon where we get to hear from our experts as to what is happening for our young people in Aotearoa and can start thinking about what we think needs to happen to respond to this. So our first speaker here today is Dr. Jude Ball. She is a Senior Research Fellow affiliated to the Department of Public Health at the University of Otago, Wellington, to the Aspire Aotearoa Tobacco Control Research Centre. She is also a member of the HCA's Smoke-Free Expert Advisory Group. Over to you, Dr. Jude Ball.
Kia ora. Thank you, Claire, and thank you, Grant, for your welcome too. So it is my pleasure to kick us off this morning. I'll just be giving an overview about the extent of the problem of vaping, and I'll also talk a bit about what the government is doing. I'm going to go fairly quickly, but these slides will be available afterwards. And I've also, at the end, I've got lots of links to documents if people want more detail. So e-cigarettes came along and were presented to governments and regulators as a lower harm alternative to smoking. And with 5,000 New Zealanders dying every year from smoking-related illnesses, this is the idea of a lower harm alternative is really attractive. But at the same time that the vape industry was selling vapes in that way to the regulators, of course, it was marketing them not to adults who smoke, but in a way that was really attractive to young people. And as Claire mentioned, this is really frustrating because New Zealand's been really successful in driving smoking down among high school students. So you can see from this graph here from the ASH Year 10 snapshot survey that when nicotine vaping was legalised in New Zealand in 2018, daily smoking was under 2% among Year 10 students. And of course, as we know, vaping has really taken off among young people. So rather than solving a problem in this age group, it's actually created one. And when we look at the latest trends, again from the ASH Year 10 snapshot survey, there is some good news to report. So the top line there in blue is ever tried vaping, and the orange line is vaping monthly or more often. And as you can see, there has been substantial declines in the last couple of years after the peak in 2021. But concerningly, vaping every day is still relatively high at 9%. And as Claire mentioned, it's that addictive, if people are vaping every day, they're very likely to either already be addicted or soon be addicted. And so And when we look at that daily vaping prevalence and break it down by ethnic group, it paints a really clear picture of ethnic disparities. So although it's 9% overall, we've got 21% of Māori Year 10 students vaping daily, and even higher, it's 24% among Māori girls, 12% for Pacifica, and for non-Māori, non-Pacific, 5%. So there are massive disparities which must be addressed. Now looking to a different survey, this is from the International Tobacco Control Youth and Young Adults Survey. It's been going overseas for quite a few years, but New Zealand was only introduced for the first time in 2023. So there's a couple of things I want you to notice about this graph. So this is showing daily or near daily vaping. And the first thing to see is that the line for New Zealand at the top right there is much higher than for other countries. So compared to Australia and Canada, our rates of near daily vaping are almost 3 times higher and 50% higher than the next highest, which is England. The second thing to notice is that there has been a slight decline between 2023 and 2024. And we also see the same in the New Zealand Health Survey. So these consistent declines across several surveys suggest that this is a real change, that we are seeing a slight decline. So good news in terms of decline, bad news in terms of really stark ethnic disparities, and New Zealand having much higher rates than other countries. And another point to note is that there's the idea that vaping is displacing smoking, and I think, it is a lower in terms of physical health. Vaping is less harmful, so that can be seen as positive. But when we look at this age group of 16 to 19-year-olds, in fact, New Zealand has higher rates of cigarette smoking in this age group as well. So when we look at any past 30-day use of any nicotine or tobacco product, New Zealand, the black line there, is much higher than the countries that we generally compare ourselves to. So this high rate of youth vaping, it's not saving our young people from smoking necessarily. So my colleagues and I have, over the past couple of years, been doing quite a lot of qualitative research with young people to try and understand this issue from their perspective. And there are some links available if you want to read more. But a really clear message that comes across from young people is that they themselves see vaping as a huge issue. So among young people who have found themselves addicted, these quotes come from those young people. It's really clear to them that they see addiction as a problem. So for example, Rangi says, there's so many downsides, I'd pay thousands if I could go back and tell myself, don't do that. So there's huge sense of regret. Tamsin's quote on the left shows how vaping can really interfere with education. It's stopping young people concentrating at school. The quote at the bottom shows impacts on cardiovascular health and respiratory health and fitness. And on the right, Trina talks about the impact on her self-image. So there are multiple impacts on young people, not only on their physical well-being, but also on their social well-being, their education, and how they feel about themselves. So what's the government doing about it? Great question. Some of you might be familiar with the Protect Your Breath campaign or education program. It started towards the end of 2022. Probably many of you listening will know more about this than I do, and how well it's reaching young people and addressing their needs. So I'd love to hear from you what you think of this and whether it's been effective. We know that education by itself generally isn't effective, especially when the environment isn't supporting behaviour change. There have been some changes in recent times. So in December 2023 and in March 2024, we got reduced nicotine limits for vaping products. Now devices must have removable batteries and a child safety mechanism. Use of cartoons and toys on packaging has been prohibited. and only permitted flavour descriptions may be used. So the flavours themselves are not limited, but manufacturers are only able to use 2 words from a list of permitted descriptors. So how has the industry responded? We did research shortly after these came in that showed that there was very poor compliance. And in fact, the intention of some of these rules was to make very cheap disposable products less available. But in fact, what happened was that retailers were selling their old stock super cheap. So you could get 2 disposable vapes for $5 in one shop that we went to. The industry has responded by changing their products, and the picture shows the new hybrid disposables that have become quite prominent. And we've also seen a rise in cheap pod starter kits. So before, the cheapest disposables were generally $10 each. You can now get a pod starter kit for that same price. The current government has recently increased fines for selling vapes to minors, but there are still issues with compliance and whether we've actually got the workforce to make sure that dodgy dairies, etc., are apprehended is questionable. There are big changes coming. So from the 17th of June this year, there will be a complete ban on the sale of disposable vapes. And vaping products are going to become less visible. So they'll no longer be allowed to be displayed in dairies and service stations and so on. And specialist vape retailers won't be able to have window displays that you can see from the outside. And another important change that people might be less aware of is that specialist vape retailers won't be able to communicate about vape products with existing customers. So at the moment, you can sign up to Vapo or, other brands online. You can put your email address in and get email messages from them, which tell you about the new products, the discounts, the, exciting new offers they've got. And so not only will they not be able to communicate with, it will be, illegal to communicate in that way, but also discounting rewards, lotteries and games are also going to be disallowed. So that's a huge change and really closes a big marketing loophole. So I'm personally quite hopeful that these changes will make a difference. But at the same time as this clampdown on youth vaping, we also have a government that wants to legalise oral nicotine products. And these have been described as the new vaping because like vapes, they're available in lots of attractive colours and flavours. They're being marketed virally online using influencers, and they're being marketed as a healthier alternative to vaping and as performance enhancing. And there's very heavy investment in these products by tobacco companies. So it seems very contradictory for the government, on one hand, to be clamping down on youth vaping, and on the other hand, opening the market up for these other youth-oriented products. A cynical person might say that the government is clearing the decks for the market leaders, which is a Philip Morris product. So in summary, most teens don't vape, but young people have been really clear that youth vaping is seen as a problem to them. The declines in youth vaping are promising, but there are really stark disparities that remain, and youth vaping remains high here by international standards. The recent and upcoming law changes are welcome. They are likely to reduce vaping uptake, but we need further equity-focused measures. For example, we don't have a level playing field, and one of the reasons why we've got high vaping among Māori and Pacifica is that in low-income communities, they have got dozens of these stores, whereas young people growing up in Kandala or, posh suburbs see very few vape stores in their communities. Another really important point to note is that a potential unintended consequence of going very tight and hard on vaping regulations is that we might unintentionally push young people towards smoking cigarettes. So it's really important that we also tighten tobacco regulations to make sure young people don't end up finding that tobacco is easier to get hold of. Vaping cessation support is urgently needed. So some of these measures might stop young people taking up vaping, but what's there for those thousands of young people who have already become addicted to nicotine? We need to design vaping cessation for Māori and Pacifica in particular, and preventive measures should also be focused on those priority groups. And in my view, the legalisation of oral nicotine products will almost certainly increase New Zealand's problem with youth vaping addiction. And there's no evidence that these products are going to help people who smoke to quit. And it seems that the only winners from legalisation of these products is likely to be the tobacco industry. So thanks for listening, folks. That's all from me. But if you're interested, I have documented these other data sources and documents that provide more detail. Thank you.
Kia ora. Kia ora. And thank you so much, Dr. Jude Bell. And it's sort of, whilst it is unsurprising in terms of the data that we've seen so far in terms of the number of students, my guess would actually have been firsthand as a school leader that than that. And I do wonder about those post-year 10 picking up the vaping habit. Also really sort of startling in terms of thinking about those oral nicotine products that are coming through on the heels of a clampdown of, we feel like we're just getting on top of one thing or starting to get on top of one thing, and we have another product that is infinitely marketable. And one of the things that I talked about when I was in meetings about emceeing this thing is this whole thing that's happening with our young people in the world today, where I talk about our young people are actually living in a world of vaping aroma. I don't know if any of you are aware, but like I think of our young people. We used to walk around the school thinking that our kids vaping. What we realize now that all of the kids, young people, all their deodorants and sprays are all designed to have exactly the same sweet, saccharine, fruity, artificial smells. And I think there's such a sense of sort of conditioning that's happening across the lives of these young people and normalizing these scents and these experiences. And the fact that we might be clamping down on vape pens and those sort of things, and then having these other things come in terms of the chewing gum is absolutely disturbing, and I think absolutely unforgivable. Our next speaker this afternoon is Professor Chris Bullen, an expert on smoking cessation and tobacco control. Professor Bullen is a member of HCA's Smoke-Free Expert Advisory Panel, and he is also a director of the National Institute of Health Innovation, a large research centre at the University of Auckland. Over to you, Chris.
Kia ora, thank you, Claire. And now, have we got the right view? Is everybody seeing the slides correctly? No? Oh, drat. Okay, we'll just go back onto this one and try this button. How's that? Okay, we're good to go? Great, thank you. Sorry, we had a few technical issues. Kia ora again. It's great to be here. I'm sort of a last-minute ring-in, so I've had about 24 hours to put my thoughts together. So I've got a bit of a potpourri of thoughts around this, and Jude's done a wonderful job in setting the scene. And there will be a little bit of repetition with my slides covering some of the material, but I think some of the points are well worth making again. So I'm going to cover sorry, we'll get through all that. Some data from the surveys, the New Zealand Health Survey and the ASH Year 10 Snapshot Survey, some analyses of those data sets for Asian youth, who are a group that are often overlooked. And then we've recently done some looking at where young people source their vapes, drawing on the ASH Year 10 survey data, the most recent data set that we were able to obtain, and some other research that I'm involved in leading for the Ministry of Health, looking at illicit trade in tobacco, but also illegal sales of vape, and it builds on Jude's wonderful work with the medical student that was published in the New Zealand Medical Journal on audit sort of secret shopper material. I've also led the work on the New Zealand vaping cessation guidance that's been rolled out to health workers around New Zealand through Te Wharaora. So I'll just share a little bit about how that relates to young people and what guidance we can give them, and then just finish off with some vaping cessation treatment research that's just about to take off. So as Jude mentioned, we've got various data sources, and we draw quite heavily on the ASH Year 10 Snapshot Survey, which is an annual survey. It's been running for many years, but from 2015, we started to ask questions in that survey about e-cigarettes, or we call them vapes now. But it's a survey of between 20 and 30,000 Year 10 students, so they're 14 and 15-year-olds. It's only 2 pages, so it's very tight, not too many questions, unlike some of the other surveys, which have got oodles of questions, but with fewer participants. So the New Zealand Health Survey has been running, again, asking about vapes since it's about the same period as the ASH survey, a smaller number of young people. So the estimates we get when you break them down by ethnic group and so forth are a little less stable from year to year. And then there have been a few other surveys that have been quite helpful. The Youth Insight Survey and Youth 2000 Survey series, and broadly all of them have pointed pretty much in the same direction, that we've got a problem with vaping. So on one hand, while smoking has come down and has broadly achieved the smoke-free 2025 goal for our rangatahi, it certainly hasn't been the same with vaping, and that's taken off, and probably the takeoff inflection point probably coincided with the arrival of cheap pods and then disposable vapes around 2018-19. So you can see just from the New Zealand Health Survey data that there's been a sort of a steady and this is where some of the questions were introduced. So 2021, 8.3%, 15 to 17-year-olds. So it's a slightly older age group than we get in the ASH Year 10 survey. So we're starting to pick up kids who are leaving school. And then 2023, 15.4%, but then that declined. But it wasn't a statistically significant decline in the New Zealand Health Survey. However, we have seen that in the larger ASH Year 10 survey. So I think there is, as Jude said, something real going on. And this is just looking at other age groups in comparison to the 15 to 17-year-olds in the top left hand. You can see the jump where smoking is very, very low. It's the daily smoking, grey lines, and the orange with 95% confidence intervals around it for daily vapors. And it takes a leap in about 2019-20, and then a little bit of a nudge downward here. But if you look at the next oldest age group, 25 to 34-year-olds, 18 to 24-year-olds, yes, smoking is coming down, but certainly nowhere near as low as with our teenagers. But vaping popping up quite a lot higher as well, and it's less popular in the older age groups. And that graph from the ASH Year 10 data that Jude showed, I think, tells a wonderful story of success with our tobacco control pressure over many, many years. And then the bump in vaping. And I guess a point here is that for many of the other age groups, there's almost a perfect crossover from vaping and smoking. But with young people, most young people weren't smokers, and they've taken up vaping in excess of the numbers that were smokers. So that hasn't been a sort of substitution. It's been much greater than that, and that's a concern. So this is regular smoking and vaping. It's a greater number because it's greater than daily smoking. I'll just skip through these because you've seen a lot of them. And this is looking at both ethnicity and gender. You can see for Māori girls, daily vaping, 25%, just coming down a little bit. But for the lowest levels are for non-Māori and non-Pacific boys and girls, Pacific in the middle, coming there. So we've got gender differences, ethnic differences, and socioeconomic differences if we showed that data, which we haven't got time to. And this is just an interesting figure from the ASH Year 10 survey showing that if you're a smoker, you're much more likely to be a vapor, a daily vapor, than if you're a never smoker. So kids who are smoking are vaping. Kids who haven't ever smoked, much less likely to be daily vaping. So these studies can help us to see what's happening at a sort of macro level, and we can go down at different levels. But then to have a sort of much more detailed level look at different population groups can be really instructive. So one of my students, Coco, who's a doctor from Myanmar, did some great work looking at Asian adolescents in New Zealand and analysed the ASH Year 10 data from 2014 to 2022 and compared vaping prevalence and associated factors in Asian adolescents as a group, and then looked at the major Asian subgroups as well, comparing them with the other ethnic groups in New Zealand. And he looked at attitudes and behaviours. So this next slide just shows the results of that analysis and by different Asian population groups and non-Asian. So the non-Asian young people are in the orange bar, and you can see that as a group, Asian young people are far less likely to be vaping than others, but you can still see the same general trend upwards over the years, and the higher levels in Indian young people. So what we don't show on this is the sex differences. So Asian girls have started to take up vaping increasingly, and their rates of vaping have doubled over the last couple of years. Still very, very low in comparison with others, and their smoking rates are very low as well. But it's something to watch and be aware of. So just in summary, prevalence of vaping amongst Asian adolescents increased year on year between 2014 and 2022, but with a much lower starting point at a slower rate compared to non-Asian New Zealand adolescents. And those adolescents identifying as Indian ethnic group showed the highest prevalence. And in all Asian ethnic groups, vaping among girls has become more common than among boys. But girls were actually much lower in 2014 than boys, so they've surpassed them. Very similar findings in some studies done with Asian young people between 2017 and 2018 in the US, but otherwise there's almost no data on the experience of Asian young people anywhere else in the world. When we dug down into the reasons for vaping, the most common reason was experimentation, curiosity. And overall, the same risk behavior and attitudes were very comparable to non-Asian adolescents here in New Zealand. So another study, as I mentioned, drilling down on the ASH Year 10 survey, is looking at where young people source their vapes, and we categorise the vapes into illicit and non-illicit based around contravention of regulations about sales to under 18-year-olds. So direct purchasing or obtaining from someone else to purchase who was in the same age group, etc. And we had over 22,000 respondents who ever vaped included in the analysis. And we identified 11 sources of vapes in 2021 and 22 and 16 and 23. And the most common vape sources were from a friend, a person their age, 35%. Buying it from a friend, their age, 13%. Getting it some other way, not so well defined because we couldn't get the detail at that level in the ASH survey. Getting it from older brother or sister, and buying from a vape shop. So buying from a vape shop directly is actually not that common a source for many young people. However, there are, I know, school ground brokers or dealers who buy and then supply. And so some of those may be picked up in some of the data. So I guess what we're learning from this research is that more effective actions are needed to address adolescents in New Zealand accessing vapes, focusing on restricting social supply, but ultimately through stronger enforcement, I think, of the illicit underage sales regulations. So you can just see on this table the different sources and we categorised them as illicit or non-illicit, but overall about 85% of sources were categorised as illicit, about 12% a little unclear. And looking at some calculations we did, being male and having higher vaping frequency, being a more frequent vapor, were statistically significantly associated with being much more likely to use these illicit sources, to have the, I suppose, the chutzpah to go in and try and put yourself off as an 18 or 19-year-old. Recently, we've done very similar work to Jude's exercise and mystery shopper audits, and this is part of the Ministry of Health funded contract. And we've just finished randomly visiting 131 randomly sampled general vaping retailers, which consist like petrol stations or supermarkets that can sell just a limited range of vapes, and specialist vaping retailers in Auckland, Rotorua, and Tauranga between December and last year and January this year. And we found, I don't know what's happened there to the note there, but a lot of the stores we thought were general vaping retailers, on entering the store, we found they were specialist vaping retailers. They were dairies. They had that store within a store phenomenon that you've probably seen in your local neighborhood. We asked about age verification, observed the type of vapes that were on sale for removable batteries, child safety mechanisms, looked at labeling, packaging, declared nicotine limit, measured their proximity to schools, marae and early childhood centres, looked at the pricing. And then we did a little bit of revisiting of 7 of the worst performing stores after the new regulations came in early January, to see if they under threat of impending or newly about to hit greater penalties for breaching legislation, whether they had changed their behaviour any. Yeah, so I can't give you the exact data, but I can say the results, because they haven't been through the Ministry of Health yet, but I can say the results mirror very much the study that you led, Jude, by finding very poor compliance with age checking, age requesting identification, but not so bad on the other aspects. However, there are quite a few stores that are still very, very close and uncomfortably close to early childhood centres and schools. And we found some very, very cheap vapes on sale still. Interestingly, of the 7 stores that were poorly performing on age ID requirement, 2 or 3 of them had started to get their act together under the change in regulations and threat of greater fines. Some of the challenges we've found doing this kind of research is the constant and rapid evolution of vaping products. So it's a kind of a case of whack-a-mole. As soon as you put some regulation in to control the products, the devious people who make the things come up with something else to skirt around the regulations. Then we've got changing regulations, trying to figure out why are things changing. It's not that easy because of the rollout of regulations, which we're grateful for, but it does make it a little bit harder to attribute the regulations to what we're seeing with the changes and trends over time. And then, as Jude mentioned, we've got the emergence of other tobacco and nicotine products, oral nicotine products, oral tobacco products, heated tobacco products, some of which are legally for sale, the heated tobacco products, the debacle earlier in the year, the oral nicotine products and oral tobacco products being talked about at cabinet level. I think I agree it would be an unmitigated disaster to let them loose. However, they are being sold online, and so people are accessing them already. One of the problems trying to analyse by subgroup is that the numbers become very small, and it's quite hard to make judgments about what's going on. And one of the other things I think is we're seeing vaping and behaviours occurring in very young people, not just the 14 and 15-year-olds, but the intermediate school students and younger than that. And accessing them for research purposes is quite difficult because of the need to get parental consent. So these are some of the challenges in trying to drill down to understand that better. So just in wrapping up, there is guidance now for health workers supporting people to stop vaping and using vaping to stop smoking. This was work commissioned by Te Whare. It's got a diagram based on the smoking cessation ABC model for asking about vaping, documenting that, and challenging all health workers to provide brief advice and and then to provide evidence-based smoking cessation, vaping cessation support. One of the problems is there isn't a lot of evidence for what works in vaping cessation, but we've taken the approach that broadly speaking, what works for nicotine dependence is likely to be effective. And so that's the advice that you'll find as you work through that guidance. There's specific guidance in that document for children, adolescents, and young people on pages 43 to 45 if you want to have a look. And we've referenced where additional resources in supporting young people, or for teachers or parents wanting to find out how to help support their young people to break free from vaping. And there's some tips here for parents. But I think fundamentally we want a very positive, supportive approach rather than a punitive approach, because we know that works with other drugs and forms of dependence. Letting your rangatahi know you care about them, and then setting some realistic expectations about their behaviour. And finally, there are new interventions that are being researched all the time. It's just that it takes a long time to get the money to do it, and takes a long time to set them up and then to do them. And by that stage, often the problems we're dealing with have sort of turned into something new. But just to let you know, we've got a new trial running. It's a randomized controlled trial comparing the effectiveness and safety and acceptability of combination nicotine replacement therapy compared with nicotine tapering on 6-month vaping abstinence. It's called the Equity 3 trial because it's got 3 arms in it. And it's its first vaping study. And we'll be recruiting children from the age of 16 and over because of the recognition that these young people are starting quite young. And many of them, as you know, do want to quit vaping, but are struggling to do that. So these are well tried and true therapies that have been used safely in a range of age groups. So it'll be interesting to see how they are accepted and if they're effective or not. It's been funded through the Health Research Council, and that will be starting to recruit participants nationwide very soon. We're hoping to recruit about 770 young people. Kia ora, that's my time up. I'm sorry
Kia
if
ora.
I've taken a little long, but there's a lot to cover. Thank you. Bye.
Kia ora. And thank you, Chris, for your insight and your expertise. I just want to make a note about the fact that there is a Q&A box down the bottom of the screen that you can access. We're taking a note of the questions that come up there, and there will be an opportunity to have those addressed at the end. There won't be a lot of time left, but we will certainly try and get to those questions if and when we can. This video will also be available afterwards, so it'll be shared back out to those who registered, and I think will be also available on the YouTube channel as well. So next up we have Sharon Pehema. She is a youth vaping educator for the Asthma and Respiratory Foundation. Sharon's work centres around building relationships with whānau, hapu and iwi organisations to identify how best to support their work in respiratory health. Over to you, Sharon.
Kia ora, Claire, ngā mihi. Kia ora koutou, tēnā tātou, tēnā koutou I tēnei wā. Ko waiahau, ko Sharon Pehema tōku ingoa. I'm the Māori Community Liaison for the Asthma and Respiratory Foundation. And yeah, thank you for the Health Coalition Aotearoa for the opportunity to come and have a kōrero with everyone today. I will share my screen. I have some slides. Taiwa. Hopefully we can see all that okay. Claire, let me know if it's not popping up. I've decided to take a little bit of a different approach with my kōrero, and it's around information. And you can see my title there, Informed, Not Influenced. I thought I would share the mahi that we have been doing in schools in terms of vaping education, some of the insights that we have seen since we've been doing this mahi. Okay, so we have been doing this mahi since June 2022. So 3 years, we are now into our of delivering workshops in schools, and it's huge. It's the demand is increasing. The types of schools that we are being asked to go and workshop with their students has changed. When we first started, it was year 9 and 10 students, and then teachers were saying, well, actually, the kids are coming to high school already being exposed already already trying vaping into intermediate schools, so we tried that. And then the same thing happened again. Actually, they're coming to intermediate already exposed to vaping. Primary school might be where we need to prioritise. And so you can see on this slide the topics that we cover in our workshops and the different education settings that we have been asked to go into: schools, kura kaupapa, bilingual schools, alternative education services, learning support units, boarding hostels, holiday programs, everywhere in our community, wherever young people are, those services, those organisations, those settings are contacting us, asking us to come and do education with their young people. And you can see the list of schools there that we have visited so far. We've done 63 schools, over 300 classrooms. That's a lot of young people to be engaging and having these conversations with. And you can see on that slide all of our funders along the bottom there, who without their support, we wouldn't be able to do this mahi. We don't get any government funding. We never have for any of this work. We've tried, but we get declined. And so we have to rely on community funders to help get us out into the regions to be able to support the schools that have reached out to us asking for support. And I will acknowledge our very first funder was Te Taurawhiri i Te Reo Māori, the Māori Language Commission, back in 2022, who saw an opportunity to bring in kupu, to bring in reo Māori into this kaupapa and start introducing new words and so seeing the importance of having education in the reo for all of our schools. Okay, so the 3 insights that I wanted to share today, and these have all come from doing all of those workshops for the last 3 years, is that one, and we know this, vaping has become normal. We used to say vaping has become normalised amongst teenagers and rangatahi, but I'm now shifting that down to our tamariki and our children. Happens before they're teenagers, starts a lot more younger than what we think. The second insight that I want to sort of touch on is around information and where do young people go for the answers that they have around vaping. It's not always where we think, and we need to really have a look at the information that we have available for young people to answer their questions. And the third insight is around us as parents, as whānau, as kaimahi, as educators. How confident and equipped do we feel to be able to have those informed, meaningful conversations with young people about vaping? Because they are formulating their own views, they are observing it, they're watching it, they're experiencing it, they're around it. And so how confident do we feel to be able to, be that influencer and give them some really good, helpful information? Okay, so that first insight, from what we've seen in our mahi, vaping is at all school levels, high school, intermediate, primary school. It's in all schools. Every school struggles with this. And those numbers there are just showing the results from our workshops that we did last year. The majority of students know someone the same age as them that vapes. 2/3 of them have been offered a vape. 44% of them have tried vaping, and then 19% of them have tried smoking. So that's across 247 different workshops that we have delivered last year. This next one is, 2025. We're now into our 4th year. What's it going to look like? Started last year visiting 2 schools, and I thought I would just I would show the questions that we asked them and their answers. This was 2 small schools. The group was about 46 students. Sometimes it's 45 in this graph because we leave it up to the students to decide whether they want to answer the questions or not. And so you can see there, even amongst the small group, 37 out of 45 know someone the same age. You can see the number there that have been offered a vape, tried a vape. We asked them, do they think the vaping industry deliberately targets young people? 40 out of 46 say yes. That's always a really strong question. Our young people are really onto it and can see it for what it is. They can see that it's a tool that's meant to help adults wanting to quit smoking, but they can absolutely see that these are targeted at their age group. And then we ask them, do they think that we have a youth vaping epidemic in Aotearoa? And you can see the number there as well. Now, we might think that this was a high school giving these answers, but they weren't. They were 2 primary schools. So these were answers from children that were in year 5, 6, 7, and 8. So we're talking about 9, 10, 11, 12-year-olds. And again, it just shows how normal it has become. It shows how they're being exposed at a much, much younger age now. And how do you do that? How do you talk to an 8-year-old about vaping compared to a teenager? Completely different age groups and information that they need. We started asking this question last year as well, around what age were they first offered a vape, to try and understand where we should position ourselves and prioritize whether it was intermediate primary school. So this was the same 2 schools last week. And you can see that, they're being offered these vapes at a really young age. Year 4 are our 8-year-olds, 8, 9, 10-year-olds. Some of them year 1 to 3, those are just our babies. And there's always more that have been offered vapes versus those that have never been offered a vape. So, this is concerning, and it's really heartbreaking when you go into these schools and you see our tamariki, going through all of this and being surrounded by this and seeing vaping. The second insight I wanted to talk about was around information and where young people go. So in our workshops, we use Mentimeter, which means that the students can go on their devices, and there's a Q&A feature that they can ask us questions anonymously. And then we go through them at the end, or we get the information back to the school after the workshop. And so have a look at this. This is just 66 questions that the kids are asking us. This isn't even from a lot of schools. This was maybe 3 schools that we did last year. We could go into the hundreds of questions that young people have about vaping. And these are really good questions, and they're really valid questions. How should I convince my friends not to vape? What if your parents let you vape? What if your family won't stop vaping? I'm addicted to vaping. How do I stay away from it? Are zero nicotine vapes bad for you? Our kids have a lot of questions, and where is this information that they need, that we need, to then be able to go and have, give them the right answers? So yeah, these questions cover everything, the social stuff, the health stuff, what's happening at home. And so we look at, in our workshops, we ask them, where would they go? If they had a question, where would they go for the answer? And they can choose from Google, asking their teacher, their friends, their whānau, or going on social media. And so Google comes out as the top answer. They're going to go onto Google, they're going to type it in and have a look. And so, if they typed in those questions from that previous slide, what answers are going to pop up for them? What websites are going to pop up for them? Is it New Zealand-based information? Is it overseas? Is it lumped in with smoking cessation websites? There's a huge gap there that we have in terms of having easily accessible, relevant, local information, not just for our young people, but also us as kaimahi as well. And if you look at that, whānau are the second option that our kids are going to go and ask. And so are our whānau equipped to be able to answer their questions, to have those conversations? We ask the kids, who's had that conversation with their parents around vaping, and how did that go? And, on the flip side, they'll be like, no, it wasn't good. I got growled, my parents yelled at me. And on the other side, it's like, I would not talk about it because my parents would overreact. They'd create so much drama, they'd assume the worst. So there's all of that, where are our awareness campaigns? What key messages can whānau give to their tamariki? And it's more than just vaping should only be used for people who smoke, or vaping is harmful. Our kids want more information than that, and you saw that on that last slide. So my third insight was around our role as kaimahi, as parents, as whānau, being the influencers for our young people. Because we can be that trusted source of information. We can have those discussions. What I've found working in schools is that, once we have their trust and they feel confident enough to talk about it with us, we can be that person that gives them that information, because we're not their parents and we're not their teacher. So we have some amazing conversations with young people about vaping. We answer all their questions. There's no judgment. It's very inclusive. And so in saying that, there's still challenges, there's still barriers that we face. One is, how confident as a workforce do we feel to be able to have those discussions? What's our knowledge like? Do we need to upskill ourselves? Where can we go for that sort of stuff? As I mentioned earlier, access to information is really limited. I know with our work, we had to create all of our own information because we just could not find what we needed to be able to engage with students at primary school, intermediate, high school. Youth vaping needs to be its own kaupapa. It's huge, and having that discussion and being kind of included in a tobacco control smoking cessation space dilutes the problem. Our young people don't see themselves in that kaupapa because they're not smoking. They're all around vaping. They see vaping. As Chris alluded to, this is the kaupapa that we need to focus on. And in all of that, we're competing against this aggressive market that just keeps bringing out new products for our kids, that keeps creating workarounds to get around the legislation. So we always have to be one step ahead. We always have to be looking at what's trending overseas, what's on social media, and coming up with messaging for when the kids ask us about those products. And so the last thing I wanted to share was that we've been doing this for 3-4 years now, and it's really exhausting and it's hard to sustain because we're having to travel pretty much on the road for the majority of the year. And recognizing that we go into communities and then we leave. And so, we all know that the best approach is to have our local kaimahi and our local schools working together and, finding solutions to this issue. And so currently we are working on packaging up all of our school workshop content, all of our the information that we use, the slides that we use, all of the documentation, all of the activities into a Train the Trainer program. Because I think that's the way that we can be the most helpful moving forward on this kaupapa. And so aiming to launch this in May. And yeah, jump onto our Don't Get Sucked In website. You'll find a page there that says Train the Trainers. There's more information there. But I think, if we could create a network of kaimahi who can come together and we can share our ideas and we can, talk about support each other in this mahi, that will go a long way in terms of helping ensure that all our young people get, information, that they can have conversations with us, that whānau feel supported, that whānau have the information. And so that's a key focus for us for this first half of 2025. And that was everything. Yes, that's my last slide there. So there's information there on our Don't Get Sucked In website. That's our vaping website. Our Asthma Foundation website has our 2024 Vaping in New Zealand Youth Survey results, and my email is there as well for anybody who would like to get in contact with me. And that is my very quick kōrero. Aroha mai if I sounded rushed, but I wanted to try and stick to our time.
Kia ora, Sharon. And I can tell you may regret putting your email up there. The amount of people that have hit the Q&A wanting to get in touch. There's a huge amount of interest as well in your Train the Trainer program. So thank you again for sharing that. So if you missed that address, it was the www.don'tgetsucked-in.co.nz/TTT. So a huge initiative going on there, and your messages resonated widely with those in our Q&A session. So thank you so much, Sharon. We are now running out of time, but I want to give each of our fantastic experts an opportunity to respond to one of the questions that came through. And I'm going to make it a bit of a double barrel question. So you're going to have about a minute each, people. And I mean a minute, okay? The questions I would like to pose to you this afternoon to close out our session. There was a lot of talk about the substance and focusing on how we can manage the substance. And one listener was asking, what about the why? Why are young people turning to vapes, and how can we address the why? So that's the first part of the question. And the second part of the question that I would like to ask you is, what do you want to see now? If you could wave your magic wand and change policy overnight, what is the one thing that you think would make the biggest difference? What is the one thing we should be fighting for? So I'm going to come back to you, first of all, Jude, with your closing statements about the why and what we need to do next.
So thanks for those questions. I think the question of why is super important, and it is something we have been exploring with young people. And the answer is that initially young people are attracted by flavors and colors, and friends are trying it, so it's novel. But the reasons that young people keep vaping, obviously addiction is part of it. Nicotine is one of the most addictive products on the planet. But also people talk about social benefits and also mental health benefits. They feel that it's helping them deal with stressful situations. And it's really interesting in the survey, the Youth and Young Adult survey of 16 to 29-year-olds, when they were asked how vaping had affected their mental health, a lot of people said not at all, but it was split almost 50-50, those that said that vaping had helped and others that said that vaping didn't help. And we see that there is a really strong link between vaping and mental health. And in the short term, vaping seems to help, but long term, actually, it's likely to exacerbate issues with anxiety, depression,
what
and
feels like a
self-image.
quick fix is actually not helping to address the issue at all.
Exactly,
Awesome.
but it's a great point that
Sorry, in closing, if you could wave your magic wand, what would you change?
We'd go back 10 years and do things differently from the beginning.
Yeah.
But yeah, I think we need both education and environmental change, law changes to make a difference.
Awesome. Kia ora. Thank you, Jude. Over to you, Chris. What about you in terms of the why and what we need to do next?
Jude's laid it out really clearly. Curiosity, novelty, perhaps peer pressure involved at the start, and then kids get dependent on the nicotine, and so it continues. And supported by, because there's large numbers doing it, it feels almost like it's the norm, and you feel a bit out of it if you're not. So I think all that great qualitative research that she and her team have been doing has been really helpful in providing those kind of insights. In terms of what I'd like to see, I think just with the new regulations coming in, I just feel that the government needs to get a bit stronger. We've got the frustrating issue of having the ability to impose fines, but actually to get that across the line and fine or take the license off someone, it seems to be an enormously difficult task. And I'd like to see reduction of density of vape stores, particularly in low-income suburbs. I mean, pretty much every store selling vapes in some areas. You know, we went to one suburb in Tauranga, and there were 5 or 6 stores just within sight of when I got out of the car. So it's just ridiculous. Nobody needs that level of availability and accessibility and visibility. So I think we just have to get better at enforcing, and a few showcase penalties and clean up our act. But we still need to
ban
leave
those oral nicotine products before they come in on shore. Surely. It's got to help.
Yeah,
Sharon.
That would be good.
What's your thoughts around the why and what next?
The why similar to Jude and Chris, but I think also the message that vaping is less harmful than smoking that did a lot of damage, because a lot of whānau, that message stayed in our heads, and it was like, compared to smoking, vaping is less harmful. At least my kids are not smoking. it was all of that sort of kōrero that was going around back then. And I think that that message has done some damage in terms of whānau feeling like vaping is okay because it's not as bad as smoking. So I think that was part of it. In terms of what next, we have tobacco control plans. We have these big national plans and strategies, but we don't have anything for youth vaping, and it's going to take investment and funding and resource and focus across everything from education, health promotion, workforce development, regulation, vaping cessation, communication. It's just, we're all trying to do our little bits and none of it's sort of working together. We do restrictions, but then we don't have enough of a smoke-free compliance and monitoring workforce to go around the retailers to keep track on them and make sure they're following the law. So it's all just messy and it needs to be under one national strategy, program, action plan.
Less of a whack-a-mole and bringing it all back together in a bit more of a conducted symphony. Thank you.
Definitely.
And I'm going to close out our session here. I want to take this opportunity to thank our fabulous 3 experts and speakers. Chris, thank you for jumping in at the last moment. It is genuinely appreciated. Thank you to each and every one of you who joined us here today. This session will be available on video and we'll make sure those contact details and links are also available as well, because I know some of you definitely want to get in touch. I'd now like to hand over to Sharon to close out the session with a karakia.
Well, thank you, Claire. Thank you for being a wonderful MC as well. And everyone who's been able to join into this forum today. I have a karakia whakakapi. It's from Scotty Morrison. And I'll do it in Māori and then in English because I think the English translation really sums up what we were trying to do today. So, te whakaitanga e, tēnei te kaupapa ka ea, tēnei te wānanga ka ea, te Māori o te kaupapa ka whakamoia, te Māori o te wānanga ka whakamoia. Koa ki runga, koa ki raro, haumie, huie, tā ki e. And it is completed, it is done. We have achieved our purpose and completed our forum. Let the purpose of our gathering rest for now. Let the vitality of our discussions replenish. We depart with fulfilled hearts and minds, bonded in our common goal and unity. Kia ora.
Kia ora. Thank you, Sharon. And once again, thank you one and all. We look forward to sharing this session with you. Thank you.